And if the drugs don't work, are there any non-drug treatments for dementia?
Well, in fact, the initial treatment for a dementia patient is not a drug treatment. In the sense that many of the disorders that affect a dementia patient can be mitigated or even eliminated with proper management by family members. A large proportion of problems involving agitation, irritability and aggressiveness on the part of dementia patients aren't due to the disease at all. They're due to the fact that their family members or the caregiver, the person who is closest to the patient, or the paid carer, whoever it may be, the problem is that that person doesn't interact with the patient in the most effective way. And what do I mean by that? Well, they ask the patient to do things that he or she isn't capable of doing. And then they get angry because the patient can't do things. He can no longer do the kinds of things that he used to be able to do. And generally in dementia patients, behaviour of this kind triggers aggressive reactions, which may be physical as well as verbal, reactions that all of us would show if we were in the patient's shoes. In other words, if you imagine that someone asks you to have a shower, for example, but you think you're clean and you don't need one because you had one yesterday, and then somebody undresses you and shoves you into the shower, imagine what you would do. You'd obviously get angry, you'd turn on the person, you'd try to send them away, or in some cases you might even hit out at them. So a large proportion of dementia patients' aggressive reactions are due to the fact that they just don't understand why they're being asked to do certain things. So to get them to do these things, they have to be encouraged in roundabout ways. Use of an occupational approach has a calming effect on many patients. The basic idea is that it is frustrating for a patient no longer to be able to do things that he or she learnt to do in the past and has done regularly for decades. But if the patient is still able to do these things, then they become calming and reassuring to them. So occupational activities derived from the patient's life history. There's no point in asking a postman to simulate making cement to build a wall. When they're derived from the patient's life history, then they have a calming, reassuring effect.
I see that music calms my father down. Are there treatments that use this?
Well, music therapy is another strategy that's been described as useful for some patients who were particularly fond of music or dancing. And here again, music is calming and reassuring. So all you have to do in this case is to try. Yeah, why not?
I've heard of other possibilities. I don't know. Cognitive stimulation, isn't it? Is that any good?
Well, cognitive stimulation has been in use for many decades now. Sometimes, yes, some patients do improve. However, the problem is that they improve their ability to position themselves in time and space, in the sense that they remember that it's daytime, but unfortunately these improvements don't generate functional improvements. They don't make them more able to wash themselves or dress or get a meal, or especially not to run a home.
Doll therapy. A friend mentioned it to me, but I don't really know what it is.
Well, I think the term therapy is probably a bit too strong for a procedure of this kind. But it does, however, make use of a primal instinct, the instinct of parenting. And it's useful in agitated patients who are in an advanced stage of dementia, a stage when patients have lost a large proportion of their cognitive capabilities, but they're not yet completely dependent. For example, they're not incontinent, they can still feed themselves. In other words, it's a medium severe stage. Now, in these patients, having something in their arms, like a doll that reminds them of a baby, can soothe them because it makes them feel useful. It makes them feel relevant within the community. It makes them feel relevant individually. And it's a very common finding in nursing homes. In some nursing homes, it does actually work.
I've also heard of transcranial magnetic stimulation. I've read something about it, the magic helmet, but I don't even know how invasive it is or whether it's recommended.
Yeah, transcranial magnetic stimulation and similar forms of electric stimulation, magnetic and electric stimulation. There is electric as well as magnetic. They're procedures that have been tried out during the last few years with some success. It's been shown that in Alzheimer's patients, for example, transcranial magnetic stimulation is able to improve linguistic skills, the ability to name verbs or actions. But to what extent this leads to improvements in daily functions, to be honest, it's not clear whether it does actually help in this area. These solutions can be considered in addition to conventional drug therapy, but at the moment it appears that there are no contraindications. If a number of parameters concerning the strength of the magnetic and electric fields are complied with, then they don't seem to significantly increase the risk of epileptic fits, which is the obvious potential risk, or other phenomena that can be even more unpleasant.